slides that I showed in my talk, you know, and 100%, I show this at every talk that I give, is the link to the Mindfulness Teachers Network, where there's some very clear guidance about best practice for mindfulness teachers, which includes guidance about who the groups are suitable, who they're not suitable for, types of groups that you would definitely need specialist supervision or expertise in if you were going to run MBSR and ECT with them. So I think, you know, that information certainly is out there, and the community of mindfulness teachers, Bangor and Oxford and Exeter and others, are very much pushing this as a resource, even though it's, you know, you don't have to do it, but this is really recommended on the basis of people's experience of what to do. But I also think, in my view, I've worked with people with psychosis, and I've definitely seen and observed that people hearing voices can, with, you know, adapted versions, thoughtfully adapted versions of the practices, radically change their experience of hearing voices in a way that massively increases their quality of life. So to just immediately say don't do it is also problematic for me. But a lot of the worries, I think, come from case studies from some time ago, often intense retreat experiences of people who are fasting and then doing really deep practices for long extended periods of time, maybe who were already having some vulnerabilities. So I don't think that's particularly research evidence that speaks to what happens in a modern day mental health setting where the practices are very short, often involving movement, the pace is extremely slow, you know, there's no fasting. So I think this makes a difference in my view. But, you know, an inexperienced teacher that doesn't really have any knowledge about psychosis going in and teaching somebody who's actively psychotic, yeah, you're probably going to have a few issues.
I think just to